made $1.7 billion worth of cuts to Medicaid. And really, they were all fairly devastating for people who rely on that as their insurance. However, from our perspective, one of the most devastating pieces was that they cut dental services for adults down to only being emergency services. So if something goes really wrong, you can go in and they'll pull a tooth, but they will do nothing to provide any kind of care to keep your teeth in better health and to do lesser procedures instead of folks ending up needing some kind of great big extraction. And the problem we have for that is, first of all, it's penny wise and pound foolish. But in addition to which, if people's mouths are not healthy, they don't eat. They certainly don't eat, a broad array of foods. And all of those infections that occur in the mouth just end up elsewhere in your body. And any dentist will tell you that. So from our perspective, this is a barrier to health, it's a barrier to good nutrition, and it ultimately will result in more costs, not less costs, to the Medicaid system. So again, we feel like it's penny wise and pound foolish, and there's no other way for folks to get dental care. It's not like there are free dental clinics around the corner. There aren't. And so this really becomes a case in which people will have no choice and they will get no care. I think the governor needs to think about the long-term impacts of the changes that are being made. So I understand that the system needs to cost less. I certainly understand that. And I understand that they needed to make cuts. But when you make cuts that ultimately end up costing more, then that doesn't make sense. And I think that dental service is one of those cuts, because really, if we can keep a person's mouth healthy, we thereby assure that any infections of the mouth don't go elsewhere in the body and create more havoc. We can also ensure that the person has the opportunity to eat high quality nutrition and to build the body. We also avert more expensive emergency treatment, both from a dental perspective, but then also what can happen as the impacts of not having dental care affect the rest of the body. So I would suggest to the governor that we really analyze whether the short-term benefit will equal the long-term cost.